From the studios of Boise State Public Radio News, I'm Gemma Gaudet. This is Idaho Matters. October is Domestic Violence Awareness Month. It's a time dedicated to the issue of abuse, as well as creating change, which is something the Ada County Victim Services Center is focused on all year. The center offers 24/7 assistance to people impacted by interpersonal violence, providing access to crucial resources like forensic medical exams, as well as safety planning, counseling, and much more. And it's all in one place. So we wanted to find out more about the important work that's being done at the center. So we invited Trina Allen, Executive Director of the Ada County Victim Services Center, as well as Anne Wardle, Supervising Nursing Manager with the Ada County Community Safe Team at St. Luke's, and Molly Kaczmarek, St. Luke's Practice Manager. I want to welcome all three of you to the program.
Thank you. We are so excited to be here.
Well, and Trina, I'd like to start the conversation with you. Can you start out by telling us a little bit more about the Ada County Victim Services Center and the work that you do there?
Yeah, I'm really excited to talk about the Ada County Victim Services Center. We have been here at the same location since 2006, providing services for individuals and families that have experienced domestic violence, sexual assault, child abuse, elder abuse, stalking, and or human trafficking. We're located at 417 South 6th Street, and we are based on a justice model. So in our center, we have, we're based on a collaborative model, and we have several different partners that are really focusing on keeping our community safe and providing numerous supports, as well as connecting with resources. So just to talk about a couple of our partners that we have in-house, St. Luke's has been one of our partners, one of our very first partners since 2006, as well as our local Treasure Valley Law Enforcement, our Ada County Prosecutor's Office, our Ada County Paramedics also are partners with us, the Department of Health and Welfare, the Idaho Network of Child Advocacy Centers, Adult Protection, as well as the WCA has rejoined our building, and we now also have Terry Riley.
So with that said, Anne, I'd like to bring you into the conversation. As I mentioned, you're the supervising nurse manager with the Ada County Community Safe Team, which is a part of St. Luke's. Can you describe what you and your team do?
Yeah, thanks. So our team is we are a sexual assault team for Ada County, and it's a group of nurses that have gone through extra training and education in order to support and medically treat those victims who have those individuals who have been victims of sexual assault or domestic violence. The team is on call 24 hours a day, and anyone can access us through that 24 hours in various ways.
And Molly, why was it important for St. Luke's to partner with this center and be partners for as long as you have been?
Well, really, this model is so unique and wonderful, providing a space for someone who's been impacted by any type of violence to be able to come to one place and really receive services from so many different partners that are all there to help that individual. Instead of having to go to many different places, they can come to one place and kind of receive the whole scope of services, from medical to mental health to case advocacy, etc. St. Luke's and St. Al's have partnered for the same program, really almost since the beginning. And yes, St. Luke's is here with our CARES clinic since 2006. That's our child abuse clinic. And then also with our adult and adolescent domestic violence and sexual assault clinic since 2013. So that's just a wide range of medical services that are here. And St. Luke's just feels that it's really important to be here with our partners where we can serve victims kind of in collaboration and provide them as much support as possible when they walk through these doors.
Mm-hmm. Trina, I want to go back to something that you said earlier, and that is that You mentioned, of course, domestic violence, but you mentioned human trafficking, other issues. So, because domestic violence can look different for people depending upon their circumstances. So, can you give an idea then of these different forms that abuse can take and who you see coming through your doors?
Sure. We see all different types of individuals who have experienced domestic violence, as well as sexual assault and human trafficking. Some things that people often don't think about is financial abuse. We have individuals who come in that have experienced being stalked by their loved one or a partner. Not only, so oftentimes people think of the physical abuse component of whether there's been a mark left on them or not, but abuse can look, it comes in many different forms. So like I had mentioned, financial abuse, sexual abuse, overall manipulation and coercion. Those are just some of the examples of folks that are coming in.
So, Trina, for someone who is thinking about leaving an abusive situation and they need to walk through your door, so many times, in order for folks to leave, they have to leave with nothing. I mean, literally, the clothes on their back, that's it. So,
Yeah.
with that said, what do you provide? Because I cannot imagine the courage it must take to walk through your doors, especially when you have to leave so much behind so often in order to do this.
Yeah. So we work with folks that are, sometimes they're just contemplating, they're kind of testing to see what's out there for additional support. But here at the center, when folks walk through our door, number one, we want them to know that they are safe, that we're here to support them, and that we're here to let them guide what they would like to do next. So that might be that they want to make a report to law enforcement, and it might not, or it might be that they are not ready to at that point. Here at the center, we provide numerous things that we have Joanne's Closet, so we have clothing available for adults. We also have the Cares Closet, which is for children. We have food and gas cards. We have the ability for some emergency shelter if they meet the criteria. We have the ability to do some lock changes. We have the ability to help with transportation. We also have, in our partnership with the WCA, we have court advocacy, we have case management. We have, with our partnership with Terry Riley, we have counseling for adult victims of sexual assault. And so there's a variety, and each case is really unique when they walk through the door. Our main purpose is to have them come in, sit down with them, and then our role is to get them connected to the providers that is the most appropriate.
So, Anne, you said you are, you are the nurse supervisor for the sexual assault team at the center. Can you walk us through what someone can expect when they do come to the center and they are seeking your specific help?
Yeah, so when someone comes to the center, we have an on-call schedule, and so the on-call nurse will be called in to come meet with the patient. And then we just sit down with the patient and we determine whether or not, well, for sexual assaults, they have the option to report to law enforcement or not. And then for domestic violence, they have to be working with law enforcement for us to see them. But we will take them to the back where our private exam room is located. It's nice and quiet. You'll be one-on-one with the SANE nurse, where you'll go over basic medical history. You'll give an account of the assault, and then the nurse will go over what parts of the exam the patient is willing to complete. And then we'll go into the exam room, we'll complete a physical exam. If at that time the patient wants to complete the forensic evidence collection, we will do that at the same time. And we also offer a few medications to help prevent some STIs. We also offer pregnancy prevention. And then when we get ready to discharge our patients, we just make sure that they're going home to a safe environment. We definitely don't want to discharge them home to the same abuser. So we do a little safety planning. And then we offer the resources that are within the building, the follow-up medical clinic, the counseling services, and case management are just some of the resources we try and connect them with.
Before I let you go, Trina, I have just under 2 minutes left, but I do want to mention the fact that today is Purple Thursday. Can you talk to us about what today is and really why it's so important?
Yeah, well, today is a really important day, but also October is really an important month. So October is the month of domestic violence awareness, but October 17th is Wear Purple Day. One of the reasons that we wear purple is the color that signifies courage, survival, and peace. And so it's a way that we can not only raise awareness, but also just to let people that may be experiencing domestic violence know that they have a team of people in their community that care about them, that want to help them, and that are here when they are ready to learn more about the resources in their community.
I want to thank all three of you for taking time to talk with us today about such an important service that you offer to our community. We've been speaking with Trina Allen, Executive Director of the Ada County Victim Services Center, as well as Anne Wardle, Supervising Nurse Manager with the Ada County Community Safe Team at St. Luke's, and Molly Kaczmarek, Practice Manager with St. Luke's. We've been discussing Domestic Violence Awareness Month and the fact that today is Purple Thursday. Thanks so much for listening to Idaho Matters. Boise State Public Radio and Idaho Matters are members of the NPR network. It's an independent coalition of public media podcasters. You can find more shows in the network wherever you get your podcasts. I'm Gemma Gaudette. We'll see you tomorrow.
The candidates for November are set.
I know Donald Trump's type.
Between now and Election Day,
we are not going back.
A campaign season unfolding faster.
Kamala Harris is not getting a promotion
Than any in recent history.
Make America great again.
Follow it all with new episodes every weekday on the NPR Politics Podcast.